Your nutrition-focused skin exam starts the moment you walk in and see your patient and look at them. There's a lot that you can gather just from looking at your patient's skin. In addition, when you shake their hand and you feel the texture of their skin, feel the temperature of their skin, you look at the color of their skin, look for hydration, that tells you a lot about their nutritional status. If you see dry skin, you're going to start to think about, is there an omega-3 deficiency? Is there a vitamin A deficiency or a zinc deficiency? And then that brings you back to the matrix and you wonder, is there something that's preventing malabsorption of these nutrients? How is their assimilation? Or do they have an increased demand for these nutrients? When you feel the back of their arm, if you feel any follicular hyperkeratosis, you're also thinking about vitamin A as well. And you're wondering, is there any genetic polymorphisms that's changing the way that their body is converting their beta-carotene into vitamin A? If you see a lot of acne on their skin, maybe on their face or their back, you're wondering, is there some toxins in their system? Or is there some dysbiosis that's impacting the quality of their skin? If you see acanthosis nigricans, it's often seen in the intertriginous areas of the body, in the neck, in the groin, in the armpit. Some darkening of the skin. You're going to wonder about, is there insulin resistance? What's their waist to hip ratio? Are there other signs of insulin resistance going on? What is their hair pattern? Has the patient lost hair, if it's a woman, on the top of their head, but they've got some hair growth on their chin or on their abdomen? If you see some lesions that are not healing, you're wondering, what's their nutrition status like? What's their protein intake? And what can I do to optimize their nutritional status? There's so many clues that you can gather from the nutrition-focused physical exam. If you see petechiae or easy bruising, you're wondering about vitamin C and vitamin K. There's another important test we can do called the Hess test that can tell us more about vitamin C. The Hess test is a way to look for capillary fragility. When you see increased capillary fragility, it may be a sign of vitamin C deficiency. So when you're doing a Hess test, you inflate your blood pressure cuff to halfway between their systolic and diastolic blood pressure. So Leslie's blood pressure today was 110/70. So I'm going to inflate the blood pressure cuff about 90 millimeters of mercury. And then we're going to hold it there for 3 to 5 minutes. After 3 to 5 minutes, you're going to get your episcope or magnifying glass. You're going to go 10 centimeters below the antecubital fossa and make a 1-inch diameter. This episcope is about 1 inch in diameter. You're going to then look for broken capillaries and count them. If you see more than 10, that can be a sign that this patient is low in vitamin C.